As the consequences, then we know the effect of the oral health. Yeah, okay, because the children will still in their growth and development, that we need to keep the deciduous tip in our mouth. Okay? And of course, as the consequences, there is an effect and there is an impact. The impact that can for the social and emotional impact and also the overall health for children. Next. So, when we know about that, and we have to keep mind that, to keep in our mind that if the teeth have a caries, it doesn't mean we should to make a restoration. Yeah, because we are dealing with growth and development. Maybe that it can be not safe and we have to extract, or maybe because of the root that cannot be treated again. But for this one, yeah, there's something that we can restore. We should know that the tooth, when the tooth should be restored or when the tooth should not be restored. We should have the treatment index, yeah, index of treatment of restoration, yeah. As you know, maybe when it's the verbal effect, when it's the biologic, like crown and root, and we should know that. And a lot of choice of restoration. Yeah, there is an direct or there is indirect. For the direct, we use kind of JC and JC component, geonomet, siphonome, or resin composite. And for the indirect, of course, that we talk about now, for the carriers with the severe decay, we need the dental crown. Next. And the case is like severe decay that it's breakdown and cannot be effectively treated with the feeling in direct restoration. We should restore with the dental crown. And then for the trauma and then for the development issue like the molar incisive hypomolarization, we should use the dental crown. Indeed. Next. Okay. When I have a school in Ghana, my professor is always like say that yes, you have a Ferrari, but because I like the Rolls Royce, then Ferrari, and then what is this? For the Tesla, and then we have the Harley Davidson in Max, but in pediatric dentistry we have the stainless steel crown and the dental crown. That is the very gold standard to treat severe caries. Next. And we know the dental crown there is can be decided for the radius anterior and posterior. For the placement there is a lift and the bonded, and then the function is for aesthetic and functional. And it will be explained for the next main lecture, I think. And for the type of crown, a lot of type of crown that is available now in the market, for the stainless steel crown, zirconia crown, and the celluloid crown with the resin composite, Bioflex, and Emax. Emax is just like a very superior aesthetic, but we should take the impression first when we decide to use that. Okay, next. And this is the picture. And we can see that where is it? Stainless steel crown, Bioflex, zirconia, Emax, and celluloid crown. Okay, next. Okay, before we continue, please pack your GSM. Please the kabut, please. And I ask you to take a photograph from the QR.
Please scan the barcode.
Please scan the barcode here. And then type the number 9604358. Maybe a little music, please. Everyone already in? And please type the name.
Anyone already joined? But not yet. Disconnect. The participant cannot join the Kahoot.
Sometimes the technical issues happen, so unexpected with expected.
Okay, maybe scan again with the
That
new
is our
barcode.
motto.
Please scan again because the pin is already changed.
551195. Okay.
Okay.
Okay, 22%, anyone? Okay, we begin for our session. This is just a polling. We have the GP for 29 people, 2 pediatric dentists, 2 pediatric from Malaysia, and in the 6 others. Okay, 1 orthodontics and 1 prosthodontics. Okay, next.
Takut gigi palsu lepas saat makan?
Because not all of us like to treat pediatric patient, right? Okay, I'm glad to see this. 31 dentist doing for the patient. Okay, next. See, like what I said, patient come just for the pain. After the relief the pain, the patient will not come again. This is what I said. Okay, next. Okay, only 21% is for restoration and 5% is for the endodontics. Because for the endodontics, it should be treated later on with the dental crown, and the restoration we will see which restoration that they put all the time. Okay, next. I'm curious about that. How many the GP put the dental crown for the patient? See, there is only 52% from the restoration using dental crown. Okay, next. There is an interesting one for the hands only and going for the replacement dental crown. Okay, next. Yeah, it's always like dental for the posterior. Yeah, okay, really in the anterior. Okay, for the both is 7%. Okay. Next. You can choose more one. for this case, for that case, actually the right answer is using dental crown. You can using the best one is stainless steel crown, yeah, or you can put the zirconia, but zirconia crown it's very easy to fracture, and for the chipping also, and the bioflag is also it's very easy to chip, yeah. That is right. So for the class 1 RMGIC is not considered as the good choice for the filling. And the celluloid crown with compomer, yes, you can do it, but it's very a lot of big decay. I'm not very confident for that. The SST is the good one to put for the restoration. Okay, class 2 GIC, I'm not consider for the GIC, but maybe for the compomer well, because it's a little big decay for the place for the GIC. GIC is very easy to pull out, yeah. Okay. The stainless steel crown, I'm not considering using the stainless steel crown also, because it can be direct restoration to put in that case. Class 2 geomer is good one, yeah, because there is a new one, the geomer, yeah, you can use for zirconomer also. Okay, next. Okay, I will prepare because the carriers is already more than 3 surfaces, so I'm not advising to use the compomer of use the GIC. I'm reconsidering to use the stainless steel crown indeed, yeah, because this is more than 3 surfaces, yeah, because from they have also in the lingual aspect, and then there is also in the proximal, and then in the vocal and something. So I'm not considering for the direct restoration. Okay, is there next? Okay, celluloid strip with class 4 compomer. I'm not recommended that also. We should using the celluloid crown with the dental material like compomer or like geonomer. Yeah, because there is a lot of surfaces that included for the dental caries. The Bioflex crown, okay. The zirconia crown, okay. Stainless steel crown, but I suggest for the with the windows, yeah. The stainless steel crown with the windows, and then we put the material like compomer of like resin composite. Okay. And we stop first, and then you still remind until which question, and then we are further with the presentation. Okay, like I said, the dental crown is for very severe decay and more than 3 surfaces, yeah. And then we all know that from dental crown we get the good protection, we get good protection, we get a preservation, and then that can be maintained for the spaces, yeah. So the children later on don't have a malocclusion. Okay, next. Just like this, it is after the pulp treatment. Yeah, the gold standard is after the pulp treatment. You should use the dental crown. Okay, next. And the process of placing dental crowns. There are 4 steps. Yeah, the first one, the initial assessment. We should assess and we should know, is this for crown or this is for the direct restoration. And then tooth preparation, we know a lot, yeah, for the teeth that with big decay that we have to reduce the occlusal, we have to reduce the proximal, the buccal and something, and reshaping the tooth so we can put it the crown. And impression taking, it's depend on which dental crown that you want to put it. For the IMAX, we should use the taking impression. For the others, no. But when you want to assess for the occlusion, for the overbite, overgite, or for the patient with the rampant caries, where is the FIDI, lost FIDI, that we want to a bit higher the FIDI to get the FIDI back, then we should take the impression. And then crown placement. Yeah, the crown placement sometimes it depends on the skill of the operator, depend on the cooperation of the patient. You can use for the 1 visit and then place the dental crown, or sometimes it's take 2 visits. Next, the initial assessment, so we should know the extent of the decay and where is the location of the tooth and the child age. For example, for the A5, the molar 2 deciduous, if the child in the age 11, we should not use the dental crown. Why? Because it will be exfoliation soon. Because the dental crown itself, yeah, the durability that we are expected is for 5 years until 10 years also for the zirconia. So when we use only for 6 months, for 1 year, so it will not considerable. Yeah. Okay. Then the cooperation of patient. If your patient is not cooperate with you, so maybe you should use the GIC first to have the good oral hygiene, yeah, to good the oral environment for the pH, for the saliva, for the everything. And then caries risk assessment. If the higher risk caries for the patient, we should use the dental crown. Okay, and then the more important thing, the expectation, the child and the parents. That is the most important. What is the expectation of the parents? If we say that this is the indication to use dental crown, yeah, what there in mind? To see the SSJ with the silver color, yeah, and then we say that, oh, we have another, the aesthetic one, but it is more expensive, and we have this one, the zirconia, and we have the Amex, it's most expensive one. So what is their expectation? So we should know their expectation and the social economic also. So you don't say that, oh, the zirconia good, but the economic from your patient is very low, social economic, that cannot be advisable, yeah? And the skills of operator, okay? Next. And for the patient, before? For the patient, the child, yeah, we know the triad of pediatric. So we should have the children for the main, for the main thing is the children, and then the parents also take influence of the decision of the treatment. Yeah. Okay. So when we know that everyone, actually the GP has had the skills lab, and then they already doing in patient for the before the graduation. We expected actually that they use crown more, but from the evidence base that we should, the evidence base that said that it's very unpopular for the GP. I'm so sorry to hear that, because the GPR doesn't like to put the dental crown in patient. Yeah, for this evidence base, they say that in American it's only 13 crown per month in 2016, and then there is a dropping also from approximately 0.44 crown per day in 2010, and then to 0.61 in 2016. So it means, yeah, it means that for GP, dental crown is unpopular, yeah. We should gain, yeah, encourage for the GP to use that more. Yeah, we know that a lot of difficulty to use also to put for the patient for the dental crown. And the reality, we already have the polling. The polling is also said that is not so many GP put the dental crown for the patient. That, yeah. Okay, next. And when we put the dental crown, yeah, actually our expectation for the positive outcomes, that the dental crown can be functional, enabling children to eat normally without experiencing more severe pain or difficulty. Yeah? And then we hope that improve oral hygiene, because they already discover all the teeth, and then promoting better oral hygiene through the reduced bacterial access, because all already discovered with the crown. And then the aesthetic improvement, yeah, the aesthetic improvement that is for the bioflex, and then for the zirconia or for the Imex. And then we hope, yeah, our expectation that is enhanced self-esteem for the patient. Okay, that they can smile, they can go to the school without any pain or something like that. And then we hope also that durability and longevity from the dental crown, yeah, it should take a long time, for 5 years or more, yeah. And then cost efficiency over time. When we put the direct restoration, something it can be pulled out, yeah, and then it's just loss of the restoration. So when we put the dental crown, we hope, yeah, we hope that they don't have any problem for the 5 years later. We don't need to to make a pulp restoration or something like that. Okay, next. But the realistic is discomfort for the children when we try to fit it up, when we try to cementation, when we try to it, just the pressure of our hand is also make a mild discomfort for the child. Yeah, and then care requirements. So we should bear in mind that we should say to the parent, after we put in the crown, it has to be to maintain the oral hygiene 2 times daily, brushing and actually in the cervical line, because that is also the problem that the plaque retain in the cervical line of the dental crown. Okay, and the appearance concern, yeah, it's depending on the material choose, what we already chosen, stainless steel or tooth color or something like that. We hope that it's perfectly do. And then the parental anxiety. We don't know actually, but there is the fact when we do the preparation, the parent and the child, the patient have the anxiety because a long of procedure, yeah, and then we have to say, to explain to the patient and to the parents what is the step to doing the dental crown. And the variability in acceptance. Sometimes allergic is happen. Sometimes it's mislodging is happen. Sometimes it's not very comfort to the child. And sometimes it's loose. Yeah. So that is the realistic. It's not only like okay, put dental crown and it's finished. Next. So when we said that is aesthetics consideration, okay, zirconia is okay, AMEX is okay, but we should put in mind that when we say the aesthetic, we should put this for the all anterior. When you put only 2, it's a different color. They have only one shade. So when we put only one like this, yeah, we know that this stainless steel crown is not aesthetic, but we can use the material, dental material, that will not aesthetic. But when we use 4 or 6 dental crown, they will be aesthetic because it's the same color, the same side. When we take a 2, no, it's still different with the remain tooth. Okay, next. The celluloid crown, when after this patient, when we do this, we see the chopping and then we see the wear resistance of the restoration. Okay, next. And when we make comparison with this is using the zirconia of my patient, and we can see that is much better than we use the celluloid crown with the resin composite. Okay, next. And then reality check based on studies, yeah. Actually, the acceptance rate when we use the crown is not high. It's only 70%, and then it's 72.5% in boys, and then child for the girls is 66.7%. And then the clinical success rates. Yeah, we said that okay, the dental the crown is good durability, but actually when we put the zirconia, the fracture and the cupping, the chipping is always happen. And then the bioflag also. Yeah, it's not like, oh, everything is fine for 10 years. No, it's not like that. And then practical appliance, yeah. I will choose more the stainless steel crown Then the other just like bioflex of zirconia for the posterior. Yeah, because it's durability and then it take long, the longevity is better than the other. Okay, next. We see, I put for the patient zirconia, it's very easy to fracture. And then I put the bioflex here and chopping. And actually I have a photo. The photo that I put one side SST and one side is the bioflex. It's only 3 months. The bioflex is just half missing. But the stainless steel crown is good fit still. Do you have? Can you show it? See, this is just come today. I put the bioflex here. I put the crown here. When we see, it's just 1 week difference. Yeah, this is the first. I put it, and this is 1 week later. You see, the chopping is very hard for the break also for the bioflex. Okay, so our expectation and our reality is sometimes different happen. Okay, next. Yeah, next. And then the failure, yeah, the failure, it's improper fittings, material failure, just like the cementation is not prepared proper, and the decay underground, gum disease, trauma or injury, bruxism, poor oral hygiene, allergic and sensitive issue. But this not discourage us to not using the dental crown. It's better using dental crown, but there is a failure. Everything have a failure also. Okay, next. What we need to do when we want to place the dental crown, we should explain the procedure in simple terms with the patient and then with the parents. So the expectation is not so high. Yeah? And then act it out, role the play with the patient. Because sometimes the problem for the GP is we cannot cope the patient. The behavior is very hard to coping for the a lot of time. Yeah, maybe for 1 hour they cannot cope again. Okay, but we should role play and use the visual aid. Say the video we can find in YouTube and we can see for the patient, and then the patient know what they should expect it from our work. Okay, next. Address fear and question, yeah. When your patient is already discomfort and you say that, yeah, what is happened, and then you try to explain more, and then maintain the positive attitude and prepare practically. So when you say that, okay, tomorrow we place the dental crown, good night's sleep, yeah, because if they don't have a good night's sleep, they will not cooperate again, and light meal, because we don't want the sugar level is high, then it's very active patient, yeah. And then during the appointment, stay close and using distraction technique, so your patient will be more comfortable if you use distraction technique, so they're not very serious that what we make preparation. Okay, aftercare instruction, that is must. So the main thing, the oral hygiene, then everything. Okay, maybe we should take the cow food, the How many questions again before we start the grand opening?
Yeah, can have. We still have 5 minutes.
Yeah. Should the participant scan? Oh, no? Should they scan again? Of you, they, okay. Okay, grab your phone, please. We will continue. Okay, next. Okay, I hope that will happen because sometimes they do not using Ronson. Okay, next. Okay, we have the 14, the surface. Okay. Easy to place, maybe someone who already put a lot of dental crown. Yeah, okay. Next. And one advice, yeah, when you put a dental crown next to each other, you should place it in one time, yeah, one time. It's not today and then the next week you put one more. No, it will be not good fit in it. So when you have two crowns, you should place in the one time, okay? Okay, it's long-term satisfaction in function, yes, okay. And then durability, longevity, enhanced self-esteem, okay. Next.
I think something wrong with the connection. Everybody still connect to the Kahoot? Yeah. Yeah, there's connection issue, Dr. Ami. Maybe we have running time too.
Okay. So, I've said a lot that I want to gain the popularity that the GP use dental crown, yeah. I want to gain it. Please use the dental crown if there is an indication for that. Don't make any kind of reason, oh, this one or this one. Please use the dental crown. You know, you already done it before in your dental program. The expectation and the reality, we can balance it when we say to the patient and we advise to the patient, and then our skill also to enhance our skill to put it. Okay, and thank you very much for the kind help to do the polling. And I would like to say thank you for the SDS, for the Adeline, that gave me a chance that to use the zirconia, the Bioflex, and then the cellulite crown. They have the King crowns, but I'm not very in touch for that brand. And thank you for the participant all. And I give for you, maybe there is any question. Thank you.
Okay, thank you, Dr. Ami, for the very interesting and interactive presentation. Now we will open discussion because the time is almost running up. We only open for 2 questions from the audience, from the participant. Please, you can raise your hand. Anyone? Because this is very interesting topic about stainless steel crown or about crown in children. Maybe you all can also sharing about in your clinic. If there are any case in your clinic that you can share with us here. Anyone?
I know why they is so unpopular. Because when we said to the patient, yeah, this should be placed for the crown, and then the parents is asking how much should I pay, and from that moment, from the patient and the parent, they are ignoring what we said. That's like we know that Bioflex here in Medan it costs 35,000 for one, and then for zirconia is 500,000, yeah, in selling rate, and then maybe because it's cheaper because I asked for SDS, and then for the SSJ, it costs maybe 150,000. Yeah. So when we take a rate and we said that for the patient, yeah, it costs 1,500,000 rupees, and the patient will say that, oh, it's okay, it will be expired. So we will wait, or maybe just extract the teeth. It's always be like that. My consideration is, please use advice for the parents how important is for the dishes to remain in the child mouth until that is exfoliated. That is my advice. So we should give insight for the patient, for the parent. This is very important to keep. It's not to pull out. To work the pull out is only 5 minutes. It's easy. But the long term is a lot of things will be happen. The malocclusion, the hygiene, and something like that. That's all. I think we don't have any. Oh yes.
Okay, please.
Thank you. It's very informative presentation. But I'm just going back further up. Yeah. So I am.
Sorry, doctor. Can you introduce?
I am Hotlinong Pusungu. I mostly work in a very rural area. And
I think you can use an Indonesian if you want. I bring this in English because the front of me
it's
is
good also for them to hear.
Oh, okay.
Yeah. Yeah, I learned and an experience that we have very high dental caries, rampant caries, and especially for kids, almost 100%. If you go to school, almost 100% have all the type of caries. But what really hurting me, no one doing really good care of prevention dentistry in Indonesia. Yeah, so when I joined a webinar with dentists from India, even during COVID, they still do the prevention dentistry, doing the fluoride in school. So this question for us, what we are doing with our community. Thank you.
Okay. That is also my concern. I said to my students, so long journey of dentistry, more than 1,000 years maybe, or more than how much, the dental caries is still exists. Yeah, right? What should we do? What have we done? Why is not going down? It's still higher. And maybe you are right about the prevention, but in Indonesia, yeah, it depends on where you learn the dental school. In Indonesia, we have inside for the American style. Yeah, for the Malaysia, I know is for the European. European is very famous for the prevention, but American is very famous for the treatment. So in Indonesia, maybe we still busy going on to treat the patient, and then maybe just a little thing for the prevention. We have, for example, the fluoride, water fluoride. We don't have a water fluoride. Maybe for the political, we should remind them that the dental caries is also high in Indonesia. But in Indonesia, for the organization for the pediatric dentists, we have make what is the name? Make a program that 2030 that will be dental-free caries for children. But I don't see it will happen. Yeah. So that's we should bear in mind also for the political, for the lecture, for the everything. Why the dental care is still high? Which have we done? What have we done actually for the genomic research, for this research? But actually the care still exists. Maybe we are doing wrong, or maybe we should catch up in time. Okay, I think there is no question anymore, and we still have a grand opening. There is
Anyone?
Any question?
Oh, there's one more, Dr. Ami.
Okay.
Yeah, please. Maybe this is the last question. Okay.
Okay. This. Thank you, Dr. Ami. Introduce myself. My name is Ifna Pramita. I want to question. I'm very interested to zirconia crown.
Yes.
What is different zirconia and porcelain crown?
Okay.
And for children crown, can is be used porcelain crown?
Okay.
Thank you.
Maybe from the dental material can help me. Because
I'm the
my
moderator.
moderator is from the dental material.
I'm a moderator.
I don't.
No,
Okay.
it's your
Zirconia is monolithic. It's different in porcelain. Yeah. If you use the porcelain, you should take an impression. Yeah. Okay, yes, right. The zirconia itself is from the monolithic. It's very different from the porcelain. The porcelain cannot be used. I don't think can be used also in. I never put the porcelain in.
zirconia choose for its strength, have the ultimate strength than the porcelain. Yes.
And
that's
the
it.
IMAX is already the new one is for the IMAX, the bioceramic. There's better durability also, if we compare with the zirconia. I think that. Yes. Okay. Is there any question? I never put the porcelain in children because it costs a lot. Okay. I think it's finished. Yeah.
Okay.
We should close.
Yeah, maybe all the participants already understand what, because you delivered the material. The material of presentation is very clearly, Dr. Ami. Okay. Due to the time constraint, we sorry that we cannot continue this question and answer. And then, if you have another question, maybe you can ask directly to Dr. Ami after this session. Okay, dear participants, we have finally come to the end of the discussion session. I'd like to thank the speaker, Dr. Ami, for the informative presentation and all the participants who have attended this session. I think that's all for me. I'll give back to the MC. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you to the speakers, Dr. Ami, and the moderator, Dr. Gigi Astrid Yudit.
Next on, we would like to present the certificate to the speaker and moderator given by Dr. Gigi Aryani, MDSC SP Pro Subspecialist, Fkg Consultant. To the doctor, time is yours.
Thank you to all the doctors. To all the participants, are welcome to enjoy the snacks that have been provided on your side. Once again, to all the participants, are welcome to enjoy the snacks that have been provided.
Kami beritahukan kepada seluruh peserta seminar untuk dapat menikmati hidangan coffee break yang sudah disediakan. Sekali lagi kepada seluruh peserta seminar, dipersilakan untuk menikmati hidangan coffee break yang sudah disediakan. Terima kasih.